There are several different types of HIV tests available, and they work by detecting different things. The most common types of tests look for HIV antibodies. Antibodies are proteins that your immune system produces when it encounters a harmful invader, like a virus or bacteria. It takes some time for your body to develop enough antibodies to be detected by a test. This is a fundamental concept to grasp when interpreting test results, especially in the context of recent potential exposure or early symptoms. These antibody tests can be performed on blood or oral fluid. Another type of test is the antigen-antibody test, often called a combination test or a fourth-generation test. These tests can detect both HIV antibodies and a part of the virus itself called the P24 antigen. The P24 antigen is a protein found on the HIV virus, and it can be detected in the blood sooner than antibodies. This means that antigen-antibody tests can often detect HIV infection earlier than antibody-only tests. These are now recommended as the preferred initial screening tests in many settings because of their ability to pick up earlier infections, shortening the window period. Then there are nucleic acid tests, or NATs. The window period is a term you will hear frequently when discussing HIV testing. It refers to the time between when a person is first infected with HIV and when a specific HIV test can actually detect the infection. During this period, someone can be infected with HIV and be able to transmit the virus, but their HIV test result may still be negative. This is because the test is looking for signs of the virus or the body's response to it, and these signs take time to develop to a detectable level. This concept is absolutely central to understanding a negative test result in the presence of symptoms. For antibody tests, the window period can range from about 3 weeks to 12 weeks, or 23 to 90 days, after exposure for most people. The body needs time to recognize the virus and produce enough antibodies to be picked up by the test. If you get tested too soon after a potential exposure, before your body has produced a detectable level of antibodies, the test might come back negative even if you have been infected. This is a common reason for a false negative result in the early stages of infection, and it can be a source of significant anxiety if symptoms are present.